I was first diagnosed with Ewing sarcoma at the age of 29. A couple of years before I was diagnosed, I felt intermittent and then continual pain in the arm. But I didn't think much of it. But as the pain progressed, I continued to seek out medical assistance, MRI and CT and such. And once the MRI result came out, it was fairly obvious that I have some sort of cancer. Dr. Chawla was very, very kind, very soft-spoken, very patient, and at the time that I was just completely upset and emotional, he calmed me down and told me that, look, having cancer is obviously nobody's desire, and it is unfortunate. However, there is a chance that we can successfully treat your disease. People from all walks of life in Dr. Chawla's office. So I get to talk to some of these people, and as I talked to them, I realized how lucky I was to have found Dr. Chawla, or be referred to Dr. Chawla as quickly as I had. And and they tell me, these fellow patients outright tell me that you are very lucky to actually start your treatment right at Dr. Chawla's office. He's the best in the field. I need to tell you that my treatment wasn't smooth sailing. I need to be honest with you. I was treated at Dr. Chawla's office using ifosfamide. Dr. Chawla had me do another scan, another MRI scan to see if the tumor area was shrinking, and unfortunately it did not, and the IFEX didn't work. Dr. Chawla got the report, called me into his office. He did say that it's quite rare that his patients doesn't respond to the IFEX treatment. Not only did it not control, it actually grew. The reality is that cancer isn't a cold. You don't just get over it that easily. And for me, it was quite a journey. But the fact is that you want somebody who is absolutely expert in this area and who's experienced enough. When the only drug that was supposed to work on me didn't work, Dr. Chawla, went back, to the drawing board and literally reformulated another set of treatment, an unconventional set of treatment. I remember at that time it was pretty severe chemotherapy. I had up to 5 chemo agents injected into me with this new treatment plan. It was very rough. I lost a lot of weight, and but by golly, it worked. So after that extensive chemo treatment, I've gradually become a little bit better, and then Dr. Chawla worked with UCLA, Dr. Eckhart, whom I respect tremendously as well, performed the surgery on me, and actually took out the primary tumor site. So after the surgery, I continued to have chemotherapy for an extensive period of time. All told, I believe I went through chemo for nearly a year. They took a look at my tumor necrosis rate, and my rate wasn't really good, number that they were looking for. They were looking for 99%, 100% necrosis rate, but unfortunately, 15% of the cells were still alive. So they know that the chemo treatment was effective, but it wasn't a cure for me. So he actually continued to treat me using alternative non-chemo methods. In other words, I was treated chemo for the first year, 3 more years of Zometa and an interferon for boosting the immune system and protecting the bone against recurrence, and then 1 last year of Zometa. But the fact is that Dr. Chawla was trying everything that he could to save my life. I would really tell you that his hard work really paid off, and I am alive here today truly because of Dr. Chawla's dedication to his patients. Hopefully this video would give you a bit of encouragement Cancer is horrible, but it does not necessarily mean the end. And again, I'm here 12 years after the fact, and life is wonderful, and I'm looking forward to every day. Thank you very much.